Hello, folks. Welcome to another edition of Inside the Marble Palace, Post Media Saskatchewan's look into Saskatchewan politics this week. I'm Murray Mandrick, political columnist for the Regina Leader Post and Saskatoon Star Phoenix. Joining me, as always, Arthur White-Crummy of the Leader Post, our legislative reporter, and from Saskatoon, Zach Besra. I'm getting better at it. I don't care what you say in terms of pronouncing it. I'm not getting better at it. Oh, Lord, I'm trying, man. I'm trying. Zach, welcome, and thanks for joining us as usual. Sorry for butchering your name, as I always do. Let's start with you, though. Ugly numbers related to both ICU counts and death rates in Saskatchewan in the last 7 days. The death rates being the highest in the nation right now, far surpassing the Canadian average, almost doubling it, I believe, and ICUs at a record level. Can you speak to those numbers and what you are hearing in terms of what is the direct cause? We obviously know the cause, but there's a lot of intricacies related to this, including how long people stay and how sick people are getting in those ICUs right now.
Absolutely. And I think if you want to go to the very root cause, we have to talk about the vaccine rollout. There was a period a few months ago when Saskatchewan led the country in its vaccine rollout. We were giving out the shot faster than we could get it. And a very common sight was people lined up in cars for hours waiting to get their shot. We all know what happened next. Our vaccine numbers started to drop very dramatically, and now we have the lowest overall vaccination rate among Canadian provinces. The vast majority of people who are in our ICUs right now and who are dying of COVID-19 are unvaccinated. And you're absolutely right, Murray. We do lead the country right now in our death rate. We are actually surpassed Alberta in that sense. If you look at the past 7 days and the past 14 days, sort of the average there. And our ICUs are more full than they've ever been. Yesterday, it was reported there were 80 people in ICU of COVID-19 in Saskatchewan. And if that doesn't sound like a lot, keep in mind that there are only 79 ICU beds total for the entire province at a normal point in time. That means more than every ICU bed that normally exists is filled with someone who has COVID-19. The reason why this is redlining our system so hard and why the health authority is so worried about this is because beds are not just beds. They're not just magical spaces. Each bed involves a number of highly trained staff who are looking after that person and helping to keep them alive. And there's so many people in ICU with COVID-19 or with other things that we've had to cancel thousands of surgeries in this province. And the health system is warning that we might have to make decisions about who receives critical care. I think another interesting part of this conversation to keep in mind, and that just sort of shows how close we are to that brink. Last week, Dr. Susan Shaw, the chief medical officer with the SHA, told me that in addition to those people in ICU, there are about 40 people in acute care, kind of on the next level down, who also have very severe COVID-19 and are on what's called essentially ventilation therapy or high oxygen flow therapy. So they're on a non-invasive ventilator, or they're receiving some pretty specialized care that in a normal point in time might actually have been treated in ICU. So what the sum up of all of this is that our intensive care system is very, very close to what some people would characterize as a collapse or a failure. And what might actually be more best described as doctors having to choose who lives or dies instead of being able to provide care to everyone.
I'm going to bring Arthur in a moment in terms of the political implication of all this, because that in itself is fascinating. But the story at this moment, I think, is as you described, Zach. It's a situation where we do have a tremendous number of people at risk of dying. And there's one thing that I'd like to explore, if you possibly can. And I don't know how much detail we do actually have on this or how much we can project, but the thing that people keep asking me is who these people are. And we obviously aren't there. We're not allowed in ICUs as reporters to be able to interview and or talk to people. We know as of today, even their families are not being allowed in as frequently as they are because of space considerations and other things. But in terms of what the doctors are telling you in terms of who these people are demographically and otherwise, can we paint a bit more of a picture for the public in terms of who is winding up in either critical care or ICUs and on ventilators right now. And we know the vast majority are unvaxxed, but that could be just about anybody. Can you describe to the best of your abilities? And sorry for asking you this because it's not an easy thing to answer, but can you describe to the best of your abilities as to who these people are?
I wouldn't expect you to ask an easy question, Murray. And yeah, we have asked, by the way, to go into emergency rooms and go to the ICU, or at least I've asked, and we haven't had the opportunity. But what emergency room and ICU doctors do tell me when I ask them about who we're talking about, they often say that it's not the stereotypical anti-vax crowd that you might have in your mind. This is mostly not that small minority of people who are very ardently opposed to vaccines. A lot of the people who are unvaccinated just never got around to it. Maybe they had some hesitancy around the vaccine, like they had outstanding questions and decided to put off getting it. Or maybe they just lived in a community where they did not perceive COVID-19 to be a threat. There's a lot of different reasons why people don't get the shot. And the result is that we really see, as I understand it, a spectrum of folks winding up in ICU. Now, there are things like comorbidities that make it more likely that you'll wind up there. We know that certain communities have been really, really hard hit by COVID-19, particularly many communities in the north and a lot of Indigenous communities in the north. But in Saskatchewan, it should be noted, we don't actually do a whole lot of data tracking about who winds up in ICU and where they're coming from. Unlike Manitoba or BC, for example, we don't track how many people who have treaty status are in ICU or in emergency rooms with COVID-19, for example. So our picture is blurry, but what we do know is that it's just not easy to characterize. It's not one small segment of society, which I think is sometimes the popular imagination.
Arthur, we know last week that the Premier tried to address this through a new center in which all planning on COVID-19 strategies will now go through. We also know that a lot of what the Premier has tried has not worked for him politically, and we're seeing that in today's Angus Reid poll, the quarterly polling for October, in which he's taking an incredible drop in terms of popularity, 18 percentage points, I believe. And the only thing comparable is seems to be the drop that Jason Kenney in Alberta seems to be taking. Let's start out with how the Premier has tried to balance the concerns that he's outlined from the past, which are basically people are frustrated with restrictions as much as they are demanding restrictions, and how that might be actually playing into today's numbers, which may or may not be a combination of people. But let's just briefly outline what you saw is the strategy in terms of last week, moving the COVID response to an emergency center basis that we'll hopefully find a little bit more about today and how it's functioning.
Yeah, it seemed as though the way that they argued for this move was that it would improve coordination between different areas of government. It might also free up some resources by being able to bring people in from other parts of the bureaucracy, other parts of the Saskatchewan Public Safety Agency. But the thing is, it's really not what frontline health workers and senior leadership of the SHA have really been asking for. They've been asking for the frontline health workers that they need to address the crisis in the ICUs and in hospitals. This won't necessarily do anything to give them those resources. And the Premier has also been taking some heat for dragging his heels on requesting that support from the federal government, something Alberta has done, gotten Army nurses to fly into Alberta to help relieve some pressures on their ICUs. The Premier noted when asked about that during his press availability last week that we shouldn't overestimate the good that support would do, because it's only going to be a handful of workers. But we're getting the sense from people in senior positions within the SHA that they're frustrated about not getting that support, because at this point, where, as Zach said, you're basically redlining a little bit of help, a few more beds, can keep you from actually having to provide substandard care. So clearly, this is starting to show up in the Premier's numbers. I mean, it's no coincidence that both Jason Kenney and Premier Scott Moe are seeing very poor approval numbers right now. Both of them were the ones that opened the earliest after the latest round of restrictions back in the summer, and were in many ways the slowest to put restrictions back into place as cases began to climb. In many ways, they've paralleled the pacing of each other, with Scott Moe often just a few days behind Jason Kenney. So it's taken a little bit longer for that to show up in Premier Moe's approval ratings. He seemed to have a bit more robust support in the August and September numbers, but with this October survey that just came out from Angus Reid, he's fallen off a cliff. It's the first time that he's dropped below 50% approval since Angus Reid began polling support for him. He's at 43% approval. More people disapprove than approve. And clearly, we were talking about this just before we started the call. He's kind of stuck because we don't know how much of this is people peeling off from the right wing versus people in the center dissatisfied with his management. So he has very little margin of maneuver here, potentially.
Well, that's an interesting question. It's the one that everybody keeps asking us. Well, the argument everywhere, social media and in political circles, is he's losing just as much support from the right as the left. I don't know if this is necessarily a right and left issue. When you are seeing things like canceled surgeries, when you are seeing things like canceled therapies for little kids and stuff, if you look at the timeline, this is a miserable question to ask a reporter because we really do not have any proper way of measuring something like this without the data, and polls don't often provide enough data in terms of asking this. But if you look at the timeline that you've outlined from August and July, and given the fact that the Angus Reid poll survey kind of overlaps or parallels that timeline in terms of this, it does seem to suggest that there is a deliberate reaction to a high caseload, particularly over the last month and a half, pretty much since the start of September, although it was starting to rise in October. Is it the last 6 weeks that you're getting a sense that are sort of the determinant in terms of why the popularity has fallen? Because if that is the case, that pretty much answers the question as to who's fallen off in terms of support for Scott Moe. Is that what you're seeing, Arthur?
Well, I mean, we don't have that level of depth in the data to go into why people have moved away from supporting Moe. We don't know whether it's because of the pandemic, but clearly that's the most salient political issue right now. And clearly the Premier's management appears to be failing by his own metrics. I mean, the integrity of the health system was always intended to be the trigger for putting in stronger public health measures. It was always the thing that the Premier said that he was the most worried about. And by that, measure, Saskatchewan is now in a crisis. And it's not just the numbers. It's also, I think, to some degree, the communication strategy. I mean, the Premier has not really been available to the public to explain the decisions that he's making to the same extent that he was earlier on during the pandemic. And sometimes his message has gotten kind of muddied by awkward responses. I mean, one of the things that was picked out during his last press appearance and really became kind of one of the memes of the event, shall we say, was him appearing to hedge on the science behind using ivermectin anti-parasitic drugs to treat COVID-19. The opposition was much clearer, saying, do not use ivermectin to treat COVID-19. There's no credible medical authority that says you should do so. The Premier said he wasn't sure about the science. I'm of the opinion that that was probably just an awkward way of phrasing things. Like he probably, he was trying to diffuse conspiracy theories through that press availability, but it kind of blew up in the opposite direction. So sometimes the way that the premier has been attempting to communicate his strategy has not always been effective.
I think that's actually a wonderful point in terms of what the struggle is with Scott Moe. We're asked this an awful lot. Why do I not understand what he's trying to say? And sometimes I think it's because he goes into these things without a clear plan, maybe trying to straddle the fence a little bit too much in his messaging, not wanting to basically be too critical or overly critical of those who are anti-vaxxers, who are anti-maskers, for reasons either related to politics and needing their support, but certainly for other reasons that kind of relate to the fact that you don't really move people by telling them that they can't do this, that, and the other thing. And that it seems to be a good opportunity to draw you back in the conversation here, Zach. Is there a sense right now, from what you're hearing from the doctors especially, that we've gone to another level in relation to how we should be dealing with this crisis that might be beyond the whole notion of whether there's a political element or not? Are you seeing out there right now, because you probably deal with doctors in terms of your discussions more than I do, and certainly other reporters do, are you sensing right now them becoming even more determined, or I guess eager to send that message to the premier that we really have to do something? We're at that point, as you discussed earlier, where there's a brink. And if that is the case, why do you think that message isn't getting through to the premier and the health strategy in a way that's more effective? As per Arthur's conversation, if anything, we're moving more away from doctor involvement in terms of our crisis management and how we're meeting this, to a committee that, from what we saw last week, didn't have much involvement from the medical community. Is that a huge frustration to the doctors right now, Zach?
I don't know exactly how the doctors feel about that specific emergency planning committee that's been set up. I think the attitude from many people is, let's see what this actually does and where it goes. What I do think we can say very firmly is that a lot of doctors, even those who in the earlier waves of the pandemic were very much sort of, stay the line kind of folks, have become increasingly more hostile towards government's direction and more willing to openly criticize it. This includes physician leaders at the SHA who are saying things now that are very much contradicting the messages that we hear from Health Minister Paul Merriman and Premier Scott Moe. There was even a moment, like you might recall, a press conference a couple weeks ago where Minister Merriman was being grilled by a number of my colleagues, and at the same time that was and he was saying that, hey, we're managing it as best we can, and we don't. He declined to use the word crisis, for example, to describe the situation. And in a simultaneous press conference with the SHA's CEO, Scott Livingston, Mr. Livingston said that we were about 3 weeks away from a triage decision having to be made, and that would come at the end of this week, by the way, and that he doesn't believe much can be done to reverse that trend. And that to me just felt like a very contradictory moment. And I've noticed that with more and more SHA people, that folks like Dr. Kevin Wasco, also an SHA executive, during the previous waves of the pandemic, was very much kind of a stick to the facts and do medicine kind of person, I think, in many respects. He's called for stronger public health measures, which is something that government hasn't done. Dr. John Marcapondo, a medical health officer at a recent town hall, said we need more public health measures right after government had declined to introduce them. So I think the messaging is becoming increasingly discordant. And I did note that in the chat, I think, of the last town hall, these meetings, these weekly meetings that the doctors do, there was a question asked about that provincial committee, and the response from Dr. Susan Shaw, the chief medical officer of the SHA, was that they were not informed, that they didn't know about that. I don't know if that's to say, I know that Scott Livingston does sit on that committee. Let's be clear about that. He's part of that leadership, so there is SHA involvement there. But I think a number of physicians are growingly kind of disillusioned with, how it's all kind of shaken out. As to why their advice isn't being taken more seriously, I don't know. I'm not close enough with the offices of either Minister Merriman or the Premier to know what the logic is here. But I think that when there's this much of a public discordance, I can only imagine the relationship has grown more sour to some degree.
Arthur, you've been nodding in agreement as Zach's talking, and I'm kind of interested in how what Zach is saying is linked to what you were saying earlier, or what we were discussing earlier about the political outcome of all this and the decline in polls, which is important because this is what tends to move government in terms of their policies. When they see something that's not working, they're less inclined to follow it. But is it a situation where after several months, maybe a little bit of public cynicism or skepticism towards how deep the problem is, that the problem itself has deepened to the point where people are recognizing the doctor's message, or the doctor's messages is, I think Zach is suggesting, is just getting through a little bit more frequently to the average person out there?
Yeah, I think a key factor is just what Zach said, that it's a new stream of voices. It's not the same people that have been sounding the alarm since early on in the pandemic. Like, those are, for the most part, incredible people. Some of them are doctors, some of them are public health experts, but the public does have a tendency to tune out when they're hearing the same people crying wolf over and over again. The wolf was often lurking, but public health measures often did put a stop to it from actually entering the chicken coop. But in this case, it's gotten in deep, and we have a new stream of doctors sounding the alarm, and I think people may be beginning to wake up to that.
Is that your? We're getting close to having to end this, and there's a lot of interesting nuance to this conversation. But is that your sense too, Zach, that we're to the point right now where people are either more in tune with doctors' voices, or hearing so many doctors' voices right now, and so much from the community, and just seeing so much in terms of reality, it's hard not to be moved by a number like 500 or 600 cases a day, when we were told long ago by Dr. Shahab that 200 cases a day would be a crisis. Is that why maybe the tide is turning in terms of the public opinion on this particular issue? I guess because it's just so obviously out there that we have a problem?
You're muted, Zach.
Oh, sorry about that.
Thank you. God, this keeps happening. I'll leave a pause.
Okay.
I think that Arthur is totally correct in that part of the thing is people warning about the wolf in the chicken coop. There's a second part to it, though, I think, which is we are watching the chickens die. And we're watching other chickens not get medical care because the chicken doctors are helping the chickens who are being torn apart by the wolf. This analogy has gone off the rails, but what I mean to say is there's been a lot of stories done, and I've done some of them, about canceled surgeries during the pandemic, about postponed medical procedures, about young children who won't have an opportunity to get their physio or their therapies that they need. I myself have written multiple stories about people who are not getting expected surgeries, or whose kids are not getting expected surgeries because of the pandemic. And I think that, more than anything, has led to a real wellspring of anger in many members of the public. It was one thing, I think, when people were winding up in hospital with COVID-19 and they were unvaccinated, and some people, I think, cruelly or not, were inclined to say, well, they made a terrible choice and that's that. But now those choices and the collective kind of burden on the health system is beginning to affect people who did everything right. And I think more people are beginning to shift some people at least are shifting that anger not towards the unvaccinated people, but towards government, saying, hey, there were probably ways this could have been mitigated or prevented. We can, again, there's a long discussion, I think, to be had about how much of this comes down to people's individual choices to not get vaccinated, how much of it was truly just poor government policy and management. I don't think you should trust anyone who says it's exclusively either of those things. But there is a lot of anger out there. And I think the combination of the doctors and seeing all these canceled surgeries is very much the source.
And I think that's a great place to end it, because I totally agree with you. I don't think it's totally Scott Moe's responsibility to ensure that everyone in the province gets vaccinated, because that's an impossible task. But it gets down to the whole notion of what we were doing and how we were doing it this summer in terms of encouraging people to get vaccinated, to get to the same rates as other provinces. We clearly haven't had that effect right now, and sadly, we're now paying for it. Hopefully next week it'll be better news when we resume Inside the Marble Palace. Zach, Arthur, thanks for joining us, and we'll hopefully see you guys again soon.